How are you today? Wonderful. My name is Dr. Matt. Very nice to meet you. I'm going to take care of you and perform a medical exam. Okay. Do you know exactly why you're here? Okay. Good. So you would like to have a cranial nerve exam? Good. Can I please have your first and last name? Good. Yes, I see here that you're a new patient. I'm gonna have to do a very thorough medical history on you. Good. Can I please have your date of birth? Good. Okay. And are you allergic to anything? Okay. Good. Anything else? And in regards to your medical history, do you have any hypertension, any kidney disease, lung disease, skin problems? Okay. And when were you diagnosed? Okay. Wonderful. Any other problems that I should be aware of? Okay, perfect. And have you had any surgeries in your lifetime? Any complications from that? Great. And do you remember at which hospital you had that done? Okay, good. Do you know your height and weight? Okay. Perfect. And are you taking any medications at the moment? How many milligrams of that? Okay. Okay, wonderful. So what I'm going to do now, I'm going to just wash my hands and I'm going to start examining you. Is it okay if I come closer? Great. Okay, let's go ahead and proceed. Okay. So can you please tell me exactly what happened that brought you into my exam room and why do you think you need a cranial nerve exam? Okay. Okay. And have you experienced any blurred vision with that? Okay, so just eye pain. Okay. And are you having any facial sensation problems? Any neurological symptoms? Okay. And any headaches? Any pain along the spine? No. Any pain inside your mouth? Okay. So what I'm going to do now, I'm just going to inspect your overall appearance. I can see that your face is very symmetric. You don't have any droopiness on your eyes. Can you please smile for me? Good. Now frown. Very good. Now can you please puff your cheeks? Okay. Keep them puffed. I'm just going to stop. Okay, very good. Can you please shrug your shoulders? Okay, very good. Wonderful. Can you please squeeze my fingers? Perfect. Okay. Can you please... Okay. Okay, so what I'm gonna do now, I'm just going to slowly palpate your head. I'm looking for any lumps, any tenderness. Okay. Do you remember hitting your head? You did. And did you lose consciousness? Okay, very good. So I'm just going to go ahead and just gently palpate. Okay. Okay. Any pain? No. Can you please look this way? Good. Can you please look the other way? Okay, perfect. Can you please touch your chin? Okay, with your chest. Perfect. Just do this. Okay, good. And now look up. Very good. Wonderful. Okay, so it looks like very symmetric. I'm not noticing any abnormalities. Good. Perfect. So the first thing that I would like to do is to check your facial sensation. I have here a Q-tip, and I'm just going to slowly touch your face, but I need you to close your eyes. Can you do that for me? Very good. So go ahead, keep your eyes closed. Can you please tell me where I'm touching you? Okay, good. Can you please tell me where I'm touching you? Keep them closed. Very good. And what about now? Okay, very good. And what about now? Good. And did you feel that equally on both sides of your face? You did. Okay. I'm going to try now with a different texture, so just keep your eyes closed. Very good. So I'm just going to gently press down on your face. Can you please tell me if you feel this? Okay, good. Can you please tell me where you feel this? Perfect. And can you please tell me where you feel this? Okay, good. And what about now? Perfect. And did you feel that equally on both sides? Good. Okay. One more time. Keep your eyes closed. Can you please tell me where you feel this? Very good. Can you please tell me where you feel this? Wonderful. And did you feel that equally on both sides? Good. Can you please tell me where you feel this? Good. And can you please tell me where you feel this? Perfect. Did you feel that equally on both sides? Wonderful. So I'm just going to slowly examine your face. Just relax for me, please. Good. Okay. Not noticing any skin abnormalities. The moles on your face look very symmetric, normal color. Good. Good, 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 good. Okay, next I'm going to check your reflexes. So I'm just going to slowly tap on your face. Tell me if you feel any kind of pain. Good. 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 Perfect. Okay, wonderful. Next, I'm going to ask you to close your eyes. Can you please tell me where you feel this on your face? Okay, very good. I'm going to do the same thing on the other side. Tell me if you feel it. Okay, perfect. I'm going to take some measurements of your face. Just close your eyes and relax. Okay, now I'm going to examine your ears and your hearing. Are you experiencing any hearing loss? No. Okay. Any pain inside your ear canal? Okay. So I'm going to inspect both ears. Good. Okay, very good. So it looks like both ears are symmetric, same level. Perfect. Okay, good. Wonderful. I'm going to just slowly palpate your ears. Any pain while I do this? Okay. Good. Okay. Perfect. Okay, I'm going to take a look inside your ear canal. Is that okay? Okay, so I'm going to come very close to you. I'm going to ask you to look this way for me. Okay, I'm just going to pull up on your tragus. not noticing any extra discharge. Tympanic membrane is non-inflamed, pearl gray, and very normal vibrations. Good. Let's go ahead and take a look on the other side. Okay, so just relax for me, please. Okay. Any pain? No. Good. Okay. So the tympanic membrane is pearl gray. No signs of inflammation or infection. Okay, wonderful. I'm gonna go ahead and check your hearing. Okay, this is a tuning fork. I'm going to strike it and put it right here behind your tympanic membrane. And can you please tell me which position here is louder? Okay, so that will be position number 1. And that's position number 2. Okay, very good. So 2. Okay. Okay, now I'm going to do the same thing on the other side. Okay, so which one is louder? This is position number 2. Very good. So position number 2. Now I'm going to do another test. I'm going to do the same thing, but just put the tuning fork behind your ear. Please tell me if you hear the sound equally on both sides. Okay, so that's 1. Now, good. I'm gonna do the same thing on the other side. Okay. Can you please tell me when the sound stops? Good. Perfect. Alright, I'm going to further check your hearing. And I'm gonna need you to tell me with which ear you hear this sound, okay? Good. Perfect. Keep your eyes closed. Perfect. Both. Very good. Okay, same thing. Keep your eyes closed. Tell me with which ear you hear the sound. Good. Perfect. Excellent. Okay, now I'm going to whisper some words in your ears. Can you please repeat them back to me? I love ASMR. Very good. Okay, gonna do the same thing on the other side. I want tingles. Excellent. So it looks like your hearing is intact. I'm going to go ahead and check your eyes next. Is it okay if I touch your face and your eyes? Okay, good. So just relax for me, please. Good. Okay, wonderful. What I'm gonna do now is I'm gonna ask you to look at my finger. So focus on my finger right here and on my nose. Okay, I'm going to shine a bright light in your face. Good. Just keep on focusing on my nose, please. Okay, I'm gonna do that a few times. Good. Focus here. Good. Perfect. Keep on focusing here. Good, 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 good. Okay, perfect. Keep on focusing here. Good, 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 good. Perfect. Can you please look at the light right here? Very good. Now look at my fingers. Perfect. Look at the light right here. Very good. Now look at my fingers. Okay. Look at my fingers. Good. Look at the light. Perfect. Look at the light. Good. Now look at my fingers. Perfect. Can you please follow the light with your eyes only? Top of your head. Wonderful. Okay. Perfect. Good. Okay. Very good. Excellent. Okay. Now can you please tell me when you don't see the light in your field of vision anymore? Now good. Now good. Now good. Perfect. fingers right here. Okay, perfect. Now look at my fingers right here. Good. Can you please tell me which fingers are moving, right or left? Perfect. Good. Very good. 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 Perfect. Good. Good. Perfect. Wonderful. Now can you please tell me when you don't see my fingers in your field of vision? Now, good. Now, good. Now, good. Perfect. Okay, very good. Okay, so go ahead, look right here. I have some shapes and I'm going to ask you to identify them. Can you please tell me what this is? Good, circle. Can you please tell me what this is? Perfect, okay. Can you please tell me what this is? Wonderful. Can you please tell me what this is? Okay, great. Okay, let's see. Can you please tell me what this is? Perfect. And one last shape. Can you please tell me what this is? Very good. Okay. Go ahead, cover one eye for me. Good. And I believe this is a good distance. So let's see. Can you please tell me what color this is? Can you please tell me what color this is? Okay, great. And what number do you see right here? Okay. And what number do you see right here? Okay. Which circle is bigger, number 3 or number 4? Okay, perfect. Can you please read the last row for me? Okay, perfect. Let's go ahead and switch eyes. I'm gonna do the same thing. Okay. Can you please tell me what color this is? Red, good. Can you please tell me what letter this is? Okay, and read the last row, starting with the last letter. Okay, perfect. Can you please tell me what number is this? 7. Okay, what number is this? 6. Okay, and which circle is smaller, 6 or 7? Very good. Okay, I'm just gonna go ahead and check your pupil size. I would say it's about a 3. Okay, so that's normal. Okay, and one last test for your eye exam. I'm gonna ask you to pinch your nose and hold your breath. Okay, I'm just going to come very close to you. Is that okay? Okay, so just focus right here in front of you, please. Perfect. I'm just going to slowly look inside your eye to make sure that your optic nerve is intact and it looks very good. I'm not seeing any scratches. Okay, and now I'm gonna go ahead and check your Now I'm gonna go ahead and check your other eye. Can you please look straight ahead? That's perfect. Okay, and I'm just gonna go ahead and take a look. Alright, it looks very good, very healthy. I'm not noticing any scratches behind the optic disc. Perfect. Okay, what I'm gonna do next is I'm going to check your mouth and your taste. Is that okay? Perfect. So go ahead, open your mouth for me, please. Actually, let me get one of these spatulas so I can check your gag reflex. Give me a big Very good. Okay, so gag reflex is intact. Can you please move the tongue up and down? Good. Now side to side. Very good. Can you please smile? Perfect. Okay, so uvula is midline. Both the tonsils are non-enlarged. Very good. What I'm going to do now is I'm going to check your taste. I'm going to put just one drop on your lip. Okay. And can you please identify this? Perfect. And I have one more taste. for you to try and identify. Okay. Very good. So just open your mouth for me, please. Okay. Perfect. Okay, so your taste is intact. Alright. What I'm going to do now is I'm going to just check your nose, make sure that it's patent. Okay, I'm going to gently press down on one hair. Any pain there? No? Okay, what about now? Gently press down on the other hair. Any pain there? Okay, perfect. Okay, so let's go ahead and just press down on one hair. Can you please tell me what this smells like? Perfect. Okay. One more. So I'm gonna need you to obstruct the other hair. Okay. Can you please tell me what this smells like? Perfect. Okay. And now keep both nares patent. And I'm gonna ask you to take a deep breath in through the nose. Tell me what this smells like. Perfect. Okay, one last thing. I'm going to check your arms for any neurological deficits. So I'm going to ask you to put your arms like this in front of me. Okay, just hold them strong. Okay, I'm just going to slowly press down. Alright, good. Now please don't let me press down. Good. And now I'm going to try to push up your arms. Don't let me do that. And I'm going to try to open up your arms. Don't let me do that. Okay, good. And I'm going to try to close your arms. Don't let me do that. Okay, very good. Wonderful. Okay. And I would also love to listen to your heart. Okay. Make sure that your heart and lungs sound good. So I'm going to put this on your chest. Just relax for me, please. Breathe normal. Okay, I can hear only S1 and S2, no S3, no S4, no extra sounds. Okay, and I'm gonna listen with the bell now. I'm looking for any murmurs. Okay, good. Okay. So I'm not hearing anything abnormal. Now let's go ahead and check your lungs. Can you please take a deep breath in? Good. And exhale. Very good. One more time. Take a deep breath in. Good. And now exhale. Very good. I'm going to listen to the sides. Take a deep breath in. Very good. And now exhale. Wonderful. I'm going to do the same thing on the other side. Take a deep breath in. And exhale. Perfect. Okay. So I'm just going to go ahead and write down the medical records, everything that I found today. And with that, we're going to conclude our cranial nerve exam. Okay. So everything looks very healthy. I think the double vision and the blurry vision that you were experiencing will go away in about 24 hours. Okay, I'm just going to write down a prescription for a powder that you just put in water and you drink it before you go to sleep, and that's going to help a lot with the symptoms you're having right now. Okay, otherwise, if you're still experiencing these symptoms in 24 hours from now, I'm just going to ask you to go to the nearest emergency room because it might be something more serious. Does that sound okay? Okay. Okay, so I think we're done here. All right. Thank you so much for allowing me to take care of you, and come back if you have any other problems. Have a good night.